Okay, welcome back. In this short presentation, I'd like to discuss the ethical scenarios that were introduced in the longer PowerPoint of social media use in physical therapy, but I really do want to talk a little bit about applications of our ethical decision-making here. Okay, so our three examples here are from the student physical therapist, PT, and the clinic regional director. This is just a reminder of what those different scenarios are, but you definitely have had a chance to look at those, read those, make some decisions. And again, just as a reminder, we want to talk through, and I want you to think about your decisions of these scenarios, the legality of them, are they professional, ethical, and would you consider doing them, and why we're not applying some of these guiding documents. So the documents that I've asked you to reference, again, are the Code of Ethics from APTA, the guide, and our social media guidelines from our local chapter, APTA Georgia. What I really want to highlight here is one of the tenets from the APTA Code of Ethics. So when in doubt, we want to act in the interests of our patients and clients over the interests of ourselves. So we don't want to be selfish. We want to really apply these core values of our profession in the best interest of the patients that we're treating. So we are in positions of power as healthcare providers as we're trying to deliver care. And we do want care to be collaborative, and we want to try to institute collaborative decision-making. But oftentimes the role that we're in comes with a little bit of that power dynamic, but also a great responsibility. So I want us to keep that in mind. So our first example of the student physical therapist who's posting descriptions of their last test. Is it legal? Well, we might not be breaking any laws by posting examples of that test. However, you might be infringing upon testing requirements or stipulations within the university and the university's laws and regulations. So you might be, if you're posting this on social media and it's found out, there could be some school decisions and reprimand. So it could be suspension, it could be expulsion. It depends how seriously they take this sort of infringement. Because if you're posting information about tests, that can be affecting course documents. Those are usually tests, and created material like this PowerPoint are usually the property of the individual who's creating them. So for you to replicate those or disperse those, you could be infringing upon those rights. So the legality within your institution could be something to think about, and the actions that could be taken for that could be something to think about. Is it professional? I want to reference the social media guidelines from APTA Georgia, and we want to engage in professional communication. This is not necessarily a professional way to go about something. If you're unhappy about a test, it should be better discussed with the professor instead of putting it out in the social media way. Is it ethical? I don't believe so, for similar reasons. It's not professional. It's not a very ethical way to go about your communication. And hopefully you have come to the decision that this is not a good thing to be doing. Second example is a physical therapist who's congratulated a patient who was recently discharged. So a lot of the decision-making for this scenario comes down to some information that you didn't have from the scenario. But part of what I wanted to puzzle on, and that is, did the patient consent to this information delivery? So did they consent to the posts that were being made? If they did not, then the physical therapist is violating HIPAA, and that is illegal. So coming back to the Code of Ethics and then our social media guidelines, we really want to protect that health information from the patient. So any identifiers for that sort of post or that sort of information dissemination, if they are personal identifiers, we are breaking HIPAA rules, and you could lose your license or something like that, or be reprimanded within our governing bodies. So locally, but also nationally, that could be really, really serious. So is it professional? Again, if the patient did not consent, it is not a professional way to go about things. Is it ethical? No. Hopefully you would not consider doing this, breaching HIPAA. If, however, and this changes things, if the patient did consent in writing to this use of their personal identifiers, and it's more of a celebratory post, hey, this person's done with physical therapy, look at how great they did. The patient is on board, they've consented, you have that consent, then the way that you're engaging with social media could be a really positive thing. It, again, if the patient is consenting, then it would be legal. It changes it. Is it professional if you're celebrating patient accomplishments? Heck yes, it is. We want to be all about celebrating patient wins in our profession. It's fantastic. Is it ethical? The patient consents, definitely ethical. Would you consider doing this? If, again, that consent is there, I would potentially consider doing this just to celebrate some of the patient successes. I'd be a little bit careful because of that need for consent and for somebody outside of the actual action of consent or written consent misconstruing it as something that it was not. In other words, a dispersal of information that was not supposed to be. So I would be somewhat careful about that. If it's something that you do with your clinic and it's very clear that everybody's consented and they're on board, that's something different, but it's not to be taken lightly, is what I want to kind of reinforce with this scenario. So the clinic regional director is promoting foam rolling and actually has stake in a company that sells foam rollers. Not ethical. Sorry, there's something going on with this slide. Just ignore that, but I want to come back to some of the stipulations and some of the code of ethics that really kind of guide our decision making with this. So is it legal? It potentially is legal, but not very professional and not ethical because of this conflict of interest. So with APTA Georgia, that claim is kind of misleading or false. So again, this regional director is in a position of power. The message that they're putting out to their listenership or readership via social media on Instagram could be taken as, look, this is a healthcare professional recommending this for my overall health needs, so I should take them seriously. But if that health message has this underlying financial contribution or conflict of interest, that is really irresponsible. So 3B, 3D, 7D from the Code of Ethics. I really want to highlight 3D and 7D because they're pretty to the point. So PTs should not engage in conflicts of interest, so not professional because of that. And 7D, physical therapists should fully disclose any financial interest they have in products or services that they recommend. So for the regional director to recommend this without disclosing that is unethical. All right, so thank you again for your attention. These are the references that I've pulled together for this brief PowerPoint, and thank you for going through those scenarios with me.